Agicipro detailed information. Agicipro contains the active ingredient ciprofloxacin. 1. Composition. Agicipro contains the active ingredient ciprofloxacin. 2. Dosage form. Agicipro is usually formulated as tablets and injectable solutions. 3. Mechanism of action. Ciprofloxacin is a broad-spectrum antibiotic that works by inhibiting bacterial DNA gyrase and topoisomerase 4 enzymes, leading to inhibition of bacterial DNA replication. This results in the inhibition of growth and death of the causative bacteria. 4. Indications. Agicipro is indicated for the treatment of bacterial infections caused by ciprofloxacin-susceptible bacteria, including respiratory tract infections, ear, nose, and throat infections, upper respiratory tract infections, laryngitis, tonsillitis, acute and chronic bronchitis, acute sinusitis. 4. Indications. Ear, nose, and throat infections, upper respiratory tract infections, laryngitis, tonsillitis, acute and chronic bronchitis, acute sinusitis, urinary tract infections, uncomplicated kidney infections. 4. Indications. Uncomplicated upper and lower urinary tract infections, uncomplicated kidney infections, uncomplicated upper and lower urinary tract infections, genital infections, gonorrhea, gynecological infections. 4. Indications. Gonorrhea, gynecological infections, other infections, prostatitis, severe bacterial enteritis, osteomyelitis. 4. Indications. Soft tissue infections, bacteremia, serious hospital-acquired infections, eye infections, infections in the gastrointestinal tract, biliary tract, prostatitis. 4. Indications. Severe bacterial enteritis, osteomyelitis, soft tissue infections, bacteremia, serious hospital-acquired infections, eye infections. 4. Indications. Infections in the gastrointestinal tract, biliary tract, prophylaxis, prophylaxis of infections in immunocompromised individuals, prophylaxis of meningococcal disease, prophylaxis of infections in immunocompromised individuals, prophylaxis of meningococcal disease. 4. Indications. Ear, nose, and throat infections, upper respiratory tract infections, laryngitis, tonsillitis, acute and chronic bronchitis, acute sinusitis, uncomplicated kidney infections, uncomplicated upper and lower urinary tract infections. 4. Indications. Gonorrhea, gynecological infections, prostatitis, severe bacterial enteritis, osteomyelitis, soft tissue infections. 4. Indications. Bacteremia, serious hospital-acquired infections, eye infections, infections in the gastrointestinal tract, biliary tract, prophylaxis of infections in immunocompromised individuals, prophylaxis of meningococcal disease. 5. Contraindications. Agicipro should not be used in the following cases: people who are hypersensitive to ciprofloxacin or any other ingredient in the drug, patients with tendon disorders or a history of tendon rupture due to fluoroquinolone use, children and adolescents during bone development under 18 years of age. 5. Contraindications. Pregnant and breastfeeding women. 6. Side effects. Agicipro may cause some side effects such as gastrointestinal nausea, vomiting, diarrhea, abdominal pain, neurological headache, dizziness, drowsiness, anxiety, insomnia, skin rash, itching, redness, musculoskeletal joint pain, tendinitis, tendon rupture. 6. Side effects. Cardiovascular tachycardia, hypotension, hematology, leukopenia, thrombocytopenia, liver and kidney, increased liver enzymes, renal failure, allergic reactions, anaphylactic shock. 7. Precautions. Agicipro should be used as directed by your doctor. Do not self-medicate. During the use of the drug, it is necessary to monitor the patient's health status to detect early signs of possible side effects. Do not use the drug after the expiration date. 7 Precautions. Store Agicipro in a dry, cool place, away from direct sunlight. Keep out of reach of children. 8 Dosage. The dosage and administration of Agicipro depend on the type of infection, age, health status of the patient, and the response to treatment in each case. 9 Drug interactions. Agicipro may interact with certain other drugs, affecting the efficacy of the drug or causing side effects. Therefore, you should inform your doctor about other medications you are taking before using Agicipro. 10 Additional information. Consult your doctor before using Agicipro. Do not use Agicipro if it is expired or has changed in color or odor. Agicipro can only be used as directed by your doctor. Do not self-medicate. Note: the information provided about Agicipro is for reference only, and does not replace the advice of a doctor. You should consult with a specialist doctor for appropriate advice and treatment.